Hi, my name is Dr. Rhea and I'm from Mumbai. This course happens to be my second course with RSD, and as usual I am really happy and very much satisfied that I attended this course. The whole idea about I think there are three things that I absolutely loved about this course. The first thing was the emotional dentistry part, where the sir actually focused on telling about how we can communicate with the patients, telling them and showing them what can be achieved through the form of test drives. I feel that's like really important, not just for the patients but also as clinicians, because you also get an idea of how we can proceed, and patients also understand that what the final result can be, and it makes it easier for the patient to accept any form of treatment. Coming to the veneers part, I think this course was entirely about how to select a veneer case, from treatment planning to executing it, how to go about it, and once it's done, what do we look out for, so right from treatment selection, treatment planning, to what happens while we prep. They also give us certain guides with complete because it's all digital, so all the it is because of all the digital guides that are made, it helps us understand how we can proceed with the veneer preps using these guides. And once we are done, how can we check how the preps are being done before we even send it to the lab, and how we can minimize all the unnecessary extra appointments or mishaps between clinician and the lab technicians, so how do we incorporate digital dentistry in the whole of veneers protocol is what was stressed on in this course. And it was really very clinically oriented, because there was a live case that was happening, so we could see right from the beginning what was happening, how the preps were done, how these guides were used, and how after the prep it was checked digitally before it was sent for milling. And the last part of the course was the hands-on part, where we got to do it in a plastic model, or the teeth prep, and we got an idea of how to use these guides, so that when we plan a patient in the future, we can also use these guides and go ahead with veneer preps. So overall, it was a very fantastic course. I learned a lot. I always enjoy RSD courses because there's so much to learn, and I really would be working in a practice where it is going to be completely digital, so I wanted to incorporate the whole workflow in my head. So that was the core reason why I came for this course, and I think it is my my level of expectations were met. And this is my second veneer course, and it was definitely very helpful for me. And every time I attend RSD courses, I feel like I'm filled with a lot of knowledge, and I would definitely recommend this course for anyone who's looking for enhancing their clinical knowledge on how to go about a veneer in veneer preps or case selection of veneer, and incorporating digital dentistry, because it's a very predictable route, because there's no everything is so precise that you can't move forward unless you're right in step 1, step 2, step 3. So it's a very predictable outcome. That's why quality work, I think digital dentistry is a go for it.